What about their nutrition? You were talking more about nutrition. What is the,
Yeah.
like, when you say about digestive system, what would
Yeah.
you suggest as the best nutritional, plan for a person? Because nutrition plays a very important role in the cancers. Yeah.
Yeah. No, so see, before obviously the patient is diagnosed, you have no control over their nutrition. So once you
Right.
come to know of it, then see again, like when you diagnose the patient and before the patient goes in for surgery or chemotherapy, there's not much time. You barely have a week or so. So
Okay.
you can't really do any radical changes to the diet or anything like that. Within 1 week, nothing much is going to change.
Right.
Yeah, because you can obviously guide them, tell them that prior to surgery or this, you have a little more healthy diet, have a high protein diet, have some probiotics or vitamins and all that.
Okay.
So, but yeah, over a period of time, suppose the chemotherapy goes on for 6 months or something, or post surgery,
Okay.
you can always tell them to have a healthier diet than what they're having. Less fatty food, more vegetables, high protein diet, and all those things. So
Right.
basically, that is post surgery. You can advise them, but before surgery or anything, it's not going to make much of a difference.
So
I
as
mean,
far as, yeah, continue, doctor.
you can optimize them. Like I said, you can for that 1 week or 10 days which you have prior to surgery, you
Right.
can give them some protein powders and stuff like that to improve their overall condition.
Right.
But the main thing would be post surgery. Yeah,
Okay. So post surgery is what we have control over, right?
yeah,
As doctors, like
yeah,
as healthcare professionals.
yeah.
Other than that, it is before cancer, there is one set of nutrition. Then while they're going through the treatment, it's another set of nutrition. And then post surgery or post the treatment is
Yeah.
a different
Yeah, I mean,
lifestyle.
not different said. It's just the basic thing. Like have a healthy diet. That's all. If you tell them very complicated things, they're not going to follow it anyways.
Oh,
So
okay.
it
Yeah.
has to be a very basic thing. Like what you do at home, just change it a little bit. Like
In
avoid oily food.
huh.
If you're having a lot of red meat, maybe cut that down a little bit. Have more
Okay.
of eggs for protein.
Okay.
You can suggest some protein powders. So these are very practical things because a lot of the patients are non-affording.
Right.
And
Right.
others also, they're used to the diet for so long, they're not going to, if you drastically change their diet, it's not going to really work. So you just
Correct.
minor changes. You can add something like a protein powder or some vitamin tablets or, omega-3 pills and all that. But apart from that, nothing drastic as such.
Doctor, also side effects when coming to cancer. There are so many side effects while the treatment is going on, while
Yeah.
there are so many. So how does one, cope with that?
No, so,
Nausea, diarrhea, constipation, like the
so
side
those
effects
are
are
mostly, yeah, so those are mostly when the chemotherapy is going on.
right.
Post surgery, there are certain effects of surgery. Like I said, post any surgery, there will be certain things like weakness.
Of
You
course.
can't get out of bed for 2-3 days.
Of course.
You won't have appetite for 2-3 days. So those are very common with surgery, unless you're doing a specific uh, cancer surgery, and there are very specific symptoms for each of them.
Right.
But most of these things which you mentioned, like nausea, vomiting, are mostly post chemotherapy.
Loss of taste also. The person doesn't have
Yeah, yeah,
any
loss
taste, so
of
that
taste.
they can't eat because
Yeah,
nutrition is very important.
yeah, loss of hair, dryness of mouth. So a lot of these things are post chemo and radiotherapy. But that when the treatment is done, they do get medication for each and everything. Like for
Okay.
diarrhea, they'll get medicines for that.
Right.
For dryness of the mouth, they have certain solutions which you keep gargling
Okay.
to keep the mouth a little moist.
Okay.
And yeah, so post every cycle of chemotherapy or post radiotherapy, that particular doctor prescribes a whole list of medicines because these are known complications or known side effects of the
You're
treatment.
expecting it to come. You're
Yeah,
expecting.
so there's a detailed treatment plan for all that.